Camastro asks about concierge medicine. Why are we seeing this trend in people leaving primary care for concierge medicine? So we've done a lot of shows on this. The reason is people are fed up with being asked to see 30 and 40 patients a day and have panels of 2,500 patients in order to make ends meet, to pay their overhead, or to be working in a big, large multi-specialty group. And they find that if they can get a membership fee yearly or monthly to take care of a population of patients, they can actually practice the kind of medicine they want to practice, where they know they can spend the time and they have the tools, teams, and trust to actually take care of patients the way they know they need to, and that unique patient in front of you. So yeah, now what we did at Turntable Health was not concierge, it was more affordable, and we put it on a federal exchange so you could actually get insurance that would cover the membership fee. And it worked really well. And that's called direct primary care. That's like concierge for the masses. So I think those are very reasonable ways to get off the grid, but really the grid has to be transformed. So if enough people get off it, maybe it'll transform out of necessity, right? And again, it goes back to this kind of sense that our systems reflect our delusion, and our current medical system is delusional. We think we can just keep throwing money in a pot and squeezing more out of healthcare professionals and more out of patients, and somehow it's going to be okay. It's not. That's delusion. It needs a total rethink. And primary care is the center of it. And in this country, we don't value primary care at all. So that's got to change before anything else can happen. How do you plan to start the revamp of medicine, says Sean? Well, we've already done a bit in terms of Turntable, which was a partner with Iora Health, which got purchased by One Medical, which got purchased by Amazon. So now Amazon has the Turntable Health model. So let's see what's next. They may normalize this kind of intensive, team-based, relationship-driven primary care that we call Health 3.0. So that's the next iteration in the waking up of medicine. Because medicine needs to wake up as a system, which means the individuals in it need to wake up to their authentic calling, what it is they're doing. Like, I can't practice in this broken system. I just can't. So I stopped doing that. And when Turntable closed, I was still rounding at the hospital and stuff. And then finally I was like, I'm just going to focus on the communications part, trying to show bright spots, which is more of what we're going to do on our show moving forward, in addition to the waking up stuff. Because again, like, if we're running broken software where we're operating from a fundamental delusion, our systems are going to reflect that. Now, none of this needs to happen. We can continue to do what we're doing. It's all a story anyways, playing out in consciousness perfectly. So part of the perfect story is I make a lot of noise about this shit because I think it should change. And you might too. Maybe part of your perfect story is your hero's journey is you quit your job and you go work for a direct primary care practice or a concierge practice, or you go do something artistic, or you realize you have enough money to live at a certain level and you're just going to focus on being. Or maybe you realize, no, I still need to make a living, so I'm going to continue to slog away in this, but I'm going to reframe it in a way that it doesn't cause so much suffering for me until I can do what I really authentically know is me. That's fine too. It's all fine.